What is atrial fibrillation? Atrial fibrillation, AFib, is a common type of irregular heart rhythm, arrhythmia, characterized by rapid and disorganized electrical signals in the upper chambers of the heart, the atria. This disrupts the normal coordination of the atria and ventricles, leading to an irregular and often rapid heartbeat. AFib can be occasional, persistent, or permanent and significantly increases the risk of stroke, heart failure, and other heart-related complications. How the heart normally beats. In a healthy heart, 1. Electrical signals originate from the sinoatrial SA node, the heart's natural pacemaker. 2. These signals cause the atria to contract and pump blood into the ventricles. 3. The signals pass through the atrioventricular AV node to the ventricles, ensuring coordinated contraction. In AFib, electrical signals are chaotic and originate from multiple locations in the atria. This causes the atria to quiver, fibrillate, instead of contracting effectively. As a result, blood may not be pumped efficiently into the ventricles. Types of atrial fibrillation. 1. Paroxysmal AFib. Episodes start suddenly and resolve on their own within 7 days, often within 24 hours. Symptoms can come and go. 2. Persistent AFib. Lasts more than 7 days and requires treatment to return to normal rhythm. 3. Long-standing persistent AFib. Lasts more than 12 months and may require aggressive treatment. 4. Permanent AFib. Cannot be corrected and the heart remains in an irregular rhythm permanently. Symptoms of atrial fibrillation. AFib symptoms vary and may include palpitations, a fluttering or racing heartbeat, shortness of breath, especially during physical activity or exertion, fatigue, feeling unusually tired or weak, dizziness or lightheadedness due to reduced blood flow to the brain, chest pain, in some cases, indicating reduced blood supply to the heart. Fainting, syncope, rare, but can occur in severe cases. Some people with AFib may have no symptoms and are diagnosed during routine checkups. Causes and risk factors. Causes: high blood pressure, hypertension, coronary artery disease or heart attack, heart valve disorders, congenital heart defects, hyperthyroidism or other metabolic imbalances, lung diseases like chronic obstructive pulmonary disease, COPD, alcohol or drug use, post-surgery, especially heart surgery, sleep apnea. Risk factors. Age, more common in older adults. Family history, genetic predisposition. Lifestyle, obesity, smoking, and excessive alcohol or caffeine intake. Chronic conditions, diabetes, kidney disease, or inflammatory conditions. Complications of atrial fibrillation. 1. Stroke. Blood pooling in the atria can form clots. If a clot travels to the brain, it can cause a stroke. AFib increases the risk of stroke 5-fold. 2. Heart failure. The irregular rhythm can weaken the heart over time, reducing its ability to pump blood effectively. 3. Other complications. Blood clots in other parts of the body, e.g., lungs, causing pulmonary embolism. Reduced quality of life due to symptoms like fatigue and shortness of breath. Diagnosis of atrial fibrillation. 1. Medical history and physical exam. Review of symptoms, family history, and risk factors. 2. Electrocardiogram, ECG, the primary test to confirm AFib by recording the heart's electrical activity. 3. Holter monitor or event monitor, portable devices that record heart rhythm over 24 to 48 hours or longer. 4. Echocardiogram, uses ultrasound to evaluate heart structure and function. 5. Blood tests, to check for thyroid function, electrolyte imbalances, or other contributing factors. 6. Stress test or imaging, to assess underlying heart disease. Treatment of atrial fibrillation. 1. Medications. Rate control, beta blockers, e.g., metoprolol, or calcium channel blockers, e.g., diltiazem, slow the heart rate. Rhythm control, antiarrhythmic drugs, e.g., amiodarone, restore and maintain normal rhythm. Anticoagulants, warfarin, direct oral anticoagulants, e.g., apixaban, rivaroxaban, Reduce stroke risk by preventing blood clots. 2. Electrical cardioversion. A controlled shock is delivered to reset the heart to a normal rhythm. 3. Catheter ablation. A minimally invasive procedure that destroys the heart tissue responsible for abnormal electrical signals. 4. Surgical procedures. Maze procedure. Creates scar tissue to block abnormal signals. Left atrial appendage closure. Prevents clot formation in the atrial appendage. 5. Lifestyle changes. Maintain a healthy weight and diet. Avoid smoking, excessive alcohol, and caffeine. Manage underlying conditions like hypertension or diabetes. Prevention of atrial fibrillation. 1. Control risk factors. Regularly monitor and manage blood pressure, cholesterol, and blood sugar. 2. Healthy lifestyle. Exercise regularly and eat a balanced diet. 3. Limit stimulants. Reduce caffeine, alcohol, and energy drinks. 4. Treat underlying conditions. Address sleep apnea, thyroid disorders, or other contributing conditions promptly. When to seek medical attention. Persistent or severe symptoms like chest pain, fainting, or shortness of breath. New or worsening palpitations. A history of AFib with signs of stroke, e.g., sudden weakness, confusion, or trouble speaking. Early diagnosis and management can reduce the risks associated with atrial fibrillation and improve quality of life.